Welcome back to Africa This Morning. We are now on Table Talk, and today we are discussing matters mental health. And joining me to discuss issues on mental health in Kenya is Dr. Catherine Syengo. Thank you so much for joining us.
Thank you.
Welcome to Ebru Africa. Let's start lightly. What's the definition of good mental health?
Yes, Beryl, when we talk of good mental health, we refer to the fact that a person is able to adjust to any adversities which might come in their lives, and that this same person is also to live up to their potential. They are able to be productive, and they are also able to relate well with other people. So those are the issues we actually look at. Are you able to cope with any adversities which come in your life? And are you able to do what you are meant to do in this earth? Are you able to reach your potential? And are you able to relate with other people as well?
Is a time duration a factor? For example, if I'm dealing with adversity, maybe the impact of the adversity will take me 3 months to get over, and someone else it will take them 1 month. Does the time frame matter when it comes to good mental health?
Yes, it matters, because when we talk about the mental health disorders, each of the disorders have a criteria where, like, for example, if you lost a loved one, there's the normal mourning expected. And we know, then we can tell you that if it goes beyond this time, and if it's this excessive to the extent that for a whole week you're not eating, you're not sleeping, or it goes on for 6 months, or it is accompanied by severe symptoms like hallucinations, like seeing things which other people can't see, or hearing things which other people can't hear, then now we can say now this is overboard. So each mental disorder has a criteria. And so the popular saying where people say that we are all mad, it's not necessarily true, because there are certain things which we look at. There is the normal expected, and then we would tell you when it goes beyond this, then it's abnormal. Yes.
Share with me now. Recently it was indicated that poor mental health in Kenya, the numbers are increasing. The stats are actually very harrowing at the moment. Why is it we are, in a sense, losing a grip of reality as a population?
For one, you see, in Kenya, the social support, being an African country, we were very cohesive in terms of the extended family and cousins and neighborhood. That is slowly breaking down as people get more urbanized and get more individualized. So the social support seems to be breaking down. But on the other hand, we also have a lot of stressors, like in terms of inflation, in terms of very many young people not employed, and they are not able to earn a livelihood. They are not in business, and there are very many educated people who have gone to the university. They are not able to find a livelihood. So those stressors, again, we are seeing a lot of violence, because we know disorders like post-traumatic stress disorder, acute stress disorders, they will increase with violence. We are also seeing a lot of violence, beginning with the time we had post-election violence. Now we have the threat of terrorism. And again, we also have even homicides, suicides. You have somebody killing their wife, or a wife killing their husband, or killing their children. So violence is also increasing, and with increased violence, then we also get increased rates of mental illness. So it's a combination of very many factors. But again, not everybody who goes through adversities gets sick. It depends on whether as they grew up, they developed self-esteem, good self-esteem. They also were supported as childhood, and again also genetic predisposition, because we know certain mental illnesses would run in the family, and that is not to say that everybody in that family will actually get that mental illness. Again, it depends on how they are able to cope with stress and how they organize their life. So it's a multifactorial, just like the way we talk of diabetes and hypertension. You can't pinpoint one thing. It's a lifestyle, it's genetic genetic predisposition, and you have to balance all those factors. And since we can't change genetic predisposition, that's why now we emphasize on trying to manipulate the environment. You may not change your genetic predisposition the way you might not change your genetic predisposition for diabetes and hypertension, but you can change your lifestyle. Even with mental health disorders, then you can also change your lifestyle to be able to cope with life.
When they're talking about changing the lifestyle and the environment and in a sense being able to better deal with the side aspects that create pressure around your life, how possible is it for someone to manage the impact that this kind of pressure can have in their life? Because now you need your family, you need your friends. If there's no proper support when it comes to the periphery aspect, for example, family, friends, your home, how are you going to be able to deal with that as an individual so that you avoid going into the track of poor mental health?
Okay, social support, you see, as we become developed, if then the family structures are breaking down, then the friendship bond can still be sustained. And again, also, how does one cope with stress as a person? For example, are you able to organize your life and say, this is how much I earn, and so I should live within my means? Or are you going beyond that and living beyond your means?
I think it's also even the way someone was raised in the family. Yes. The fact that you don't have some skills,
yes,
and maybe you have the media as the only yes, influence in your life. Those
yes,
are some of the aspects that get someone to a point of delusional lifestyle, if I may call it that way.
Yes. Again, things like simple things like exercise, eating good diet, I mean well-balanced diet, healthy diet, because we know there's a relationship between physical health and mental health, that you cannot be in pain and you are mentally stable, because those things, your physical health will affect your mental health. Your mental health also affects your physical health. So people have to bring in their lifestyle, they have to live a healthy life, like exercise, eat well, manage stress, and manage relationships so that you don't feel lonely, you're able to cope with life. And above all, again, we say that if you can't change a particular thing you're not happy with, then learn to cope with it. If you can't change it, learn to cope with it. You either fly or learn how to live with it. Yes.
I think that brings me to the point of personal responsibility when it comes to mental health.
Yes.
And if someone has not grown up in an environment where they have a good idea of their self-worth, they've had a nurturing nurturing environment when it comes to their self-confidence.
Yes.
How can they do that by themselves if they're an adult and they've never known the path of, a positive lifestyle? How can they adopt that now?
Yes, of course, it would be good if everything went on right from childhood. And things were done well, so that everybody grew up with the right skills and with the right strategies to deal with life. But again, we also, that's why we have various specialists in mental health, so that if something goes wrong, you can still be assisted. It doesn't mean because things went wrong as you grew up that they cannot be corrected. So again, if you find that as an adult you are breaking down, and I tell people to just observe simple things. Are you able to sleep well? Are you able to eat well? Are you enjoying life? Do you have to force yourself to go to work, or do you enjoy going to work? Are you able to have friends? There are people who cannot sustain relationships because they don't have the right social skills or some other reason. So if you observed, and again, if you are living with the people you live with, some mental illnesses reach to a point where the person suffering from them cannot actually tell they are sick. So by observing the behavior of the people you are living with, if you start seeing abnormal behavior, or somebody is thinking in abnormal way, or they don't want to get out and work. Remember, we've defined good mental health, that you should be able to live up to your potential and do what you're able to do. So if somebody reaches a point where they don't feel like getting out of bed to go and work, or for some reason they are not able to cope with life, then the people living with them need to seek help. The fact that somebody breaks down later on in life, they can still get help, but we are seeing a lot of stigma, especially when we have patients who are seen by general practitioners or other specialists, and they are referred, you're told, go and see a psychiatrist. Many people will take forever to see the psychiatrist. They'll seek a second opinion, a third opinion, and a fourth opinion.
Even if
before,
the prognosis is the same, they
yeah,
still stick
before
on the
they
same
can
path.
actually now gain the confidence, because it is even worse when you refer them to the government hospitals, and you see as economic strains increase, then people should be able to utilize the government facilities, which are actually subsidized by the government. It is even worse, like for example, if you refer somebody to Madari Hospital, which is the National Referral Psychiatric Hospital, people will say, no, I'm not, my illness is not, I'm not mad. Because people don't understand that mental illness is not just that person collecting garbage out there. It can be anxiety, it could be sleep disorder, it could be depression, it could be severe like schizophrenia, it could be a mood disorder. So people, the stigma. Again, when people, I see people like the people we treat, even when you are giving them a sick cough, they are very careful what paper you put the sick cough on, because when they take it to work and it shows that they are seeking mental health services, they are stigmatized. So we need to remove the stigma. We need to have people who have been treated for mental illnesses coming out and saying, I've been treated for this and I'm well, so that other people can know it's not a disease you should hide.
That's a mileage that we might actually wait a very long to actually bear fruit on. Maybe you can tell us, what are you doing as a practitioner at Mathare Hospital, and also a practitioner who's working at the, the beginning of the problem, which is parenting at your clinic. Maybe you can share with us what strategies you're doing to ensure that mental health is considered as an avenue people need to focus on when it comes to ensuring that one grows up to be a very productive individual.
For one, we realize that the society does not understand a lot about mental health. So giving the information out there, you touch many people, because people could be going through depression and they are not aware that they're actually going through depression. And their family members could be labeling them, you are lazy, what is wrong with you? And by the time they reach hospital, then it has gone to the extreme. Some have even tried to commit suicide. So by giving the information for the society to know, then at least you reach many people, and hope that some people can seek treatment. Again, try to prevent. When we are, I told you, causes of mental illnesses are multifactorial.
Yeah.
There are things we can't change, like a genetic predisposition. Like if in your family lineage somebody had a mental illness, chances are that you're predisposed. Since we can't change that, then we change the other factors, because it's not purely related to the genetic composition. Then we change the environment, and that's why me and my colleagues came up with the Nairobi Parenting Clinic to make sure that parents understood what the right way to parent, the right skills and strategies. It is important to have a child develop their self-esteem. It's also important to have a child who is well controlled in terms of they are able to fit in the society, because Beryl, as you come to work here, you realize that there are certain rules you need to obey, like you have to be at work at a certain time. There is authority you have to respect. And if you come up with a child who doesn't realize that in life there are rules which need to be followed, there is order, and again, this child, it's not, from the African setup, a child was there to be seen, not to be heard. We also realize the importance of self-esteem, because you can have a child who is very disciplined, but on the other hand, they do not have a self-esteem. That means they will not be able to reach their potential. They might not be able to speak in public, they might not be able, they think they are not good enough, and so that limits their potential.
Those are some of the ones that are pretty interesting for me, the ones who camouflage. You just seem like you're a very functional individual, but yet you're holding a serious problem within you. How do you manage and how do you detect those individuals? They're the ones who usually explode in society.
Yeah, we still see people who will come and say, I've always gone through this is how I've always coped. Or some people will even, especially men, would go into drugs to treat some of those anxieties, some of those problems they might be having. And then they land to you, to your office, because they are addicted to alcohol, for example, or because they are using cannabis, or a child who has problems, they start using cannabis. As you treat the drug abuse, you realize there are underlying factors. Either this person does not have a good self-esteem, and so they have to cover up with this, or you find somebody has broken down because their marriage is breaking down. When you go deep inside to find out what is causing the problem, you realize that one of the spouses actually has issues they need to deal with for them to be able to function. Yes.
Maybe you can share with us now, when you're dealing with, as you pointed out, the gender matter, men are very rarely able to access counseling sessions, and the idea that they need counseling can be really, I don't know what word to use, but it can really demoralize their identity as men. How are you working to push the campaign when it comes to men engaging their families and also being more balanced when it comes to realizing that there's an impact from society to their psychological environment?
Okay, to do that effectively, for one, the reason why there's even a gap in mental health treatment in Kenya is because for a long period, the University of Nairobi, which trains doctors, was not examining psychiatry for undergraduates. That means the doctors who graduated didn't have as much exposure in psychiatry. Now the case has changed, and at that time you could only learn psychiatry if you came for masters in psychiatry, and so you released those doctors to go and treat people all over the country. And so when they met a patient with a psychiatric illness, they were not able to even refer because they might not be confident that that is what they're dealing with. But if we had the primary people, and that's why we are saying we need to incorporate mental health in primary care. Like we've had the medical training colleges train nurses. We also have nurses going back for in service and clinical officers, so that the basic at the health center there, the person you find there can be able to tell you this is not malaria, this is depression, or this is anxiety, or this is somatization disorder. So when you are able to catch it at that point, then you can be able to refer or give the right treatment. But when it comes to, so in that case, even the men who might not willingly decide I'll need to go for counseling, if they are told by the person treating them that your illness will need 1, 2, 3, and you have to go for this treatment, then they are likely to consider it. But again, we also know that depression and anxiety are more in women. So that doesn't mean it's only the men who have problems. So everybody needs to know about it. We need the primary care physicians to have the right knowledge so that they are now able to refer, diagnose, refer, whatever they are able to treat, and whatever they are not able to refer, they refer. So that if somebody is referred, then they realize I need this treatment.
You've touched on the academic institutions and building the capacity of our medical graduates. Let's look at the investment of the government, adding on to the challenges that we have when it comes to training medical students. What is the government doing? What can it do more? And what can the population do more when it comes to accepting that mental health is an issue that they need to deal with?
Yeah, for one, as much as we talk of stigma of mental illness, even the career, not many people are interested. And you see people specialize, it's open. You're told, choose whatever you want to specialize in. When you become a general doctor and you've decided I want to do a master's, then it is up to you to choose what you're interested in. So because in the previous years, people did not get exposure in psychiatry in their undergraduate, then it became rare for people now to choose psychiatry. But now when it opened up and they have to do an exam, then now it is opening up. So, but again, when it comes to the Ministry of Health, they consider then, like if you apply to be sponsored to go and study psychiatry, they are likely to consider you more because they have less professionals in that, and defer somebody else, for example, who wants to do obstetrics and gynecologist, because there are many people in that career, or surgery, for example. So like if they are sponsoring, then they will, there's affirmative action where they decide now for careers which have fewer people, then we need to sponsor more people. But again, even when that is done, you still find few numbers still coming for psychiatry. Again, I've told you that at MTCs, through WHO, they are now retraining the ones in service, and every MTC now they also have to get psychiatric exposure.
That's
so
a medical training institutions in Kenya.
Yes, the medical training colleges for the nurses and clinical officers. By the time they get out, then they have basic knowledge. Yes.
Maybe in closing, what we need to do, because we've touched on the fact that it's a situation that's the numbers are increasing. The country is at a standstill at the moment. Yes, there are graduates who are going to be, in our health centers very soon, but what can we do at the moment as an individual to be more conscious about our health environment, mental health environment, and our social environment to ensure that we are not perpetuating the numbers?
Yeah, I would tell the public that we've said that for you to know whether you have good mental health, check, there's a simple check. Are you able to reach your potential? Do you feel that there's something you've always wanted to do, but something inside you limits you? Yet you might have the capability. 2, are you able to relate well with people at work, at home? Do you have difficulties? That can point to that. 3, when you face adversities, how do you cope? Because again, if you feel that like you've gone through a certain calamity, and you feel that you are disoriented for a long time, don't just assume that this is normal. Seek help. You'd rather seek help and be told this is okay, this is normal,
is how you need to get
than
out
to
of
stay
it.
on and it progresses to be very severe. And again, let people be generally healthy. Because I told you, if you're not physically healthy, then you cannot be
It
mentally
impacts
healthy.
your
Let
mental
people
capacity.
eat healthy diet, let them exercise, let them check their weight. I know it's a difficult basic
Especially for
things.
women.
Yeah.
Maybe you
Yeah.
can tell us what's the next agenda right now in closing. What can we expect from Mathare Hospital in terms of changing the perception of the public? Because that's a situation that we've always needed to happen. The mental health situation has been a discussion on the table for the longest time. What do we need to do now to push the agenda forward?
Okay, for one, I would like to say in Mathare Hospital, at least the government, through the Ministry of Health, has increased funding for provision of drugs to the patient, funding for provision of non-pharmaceutical things like gloves and all that. And so that is a welcome, because it means every patient who comes to Mathare Hospital and they need treatment, then they cannot miss drugs. But again, treatment of mental illnesses is not just medicine.
Yeah.
The ministry has not employed any psychologist. There's no psychologist employed. And so you find the few doctors who are there have to do the counseling, psychotherapy, and also give medication, yet we are understaffed. The psychiatrists, the nurses, and the doctors who are there. So we hope that the government will eventually have those cadres so that we can have a comprehensive care. Again, there's shortage of human resource. As much as the drugs and the non-farms are there, and they're improving the infrastructure as well, by the fact that they made it a national referral hospital. That means even the funding increases. That means the consideration by the government, because the funding is consumerate on your
And the capacity of patients that you're going to be dealing with.
yeah, and your level, because there is level 1 up to level 6. We are now level 6. So things are improving. But again, we would want everybody, like the new constitution says, everybody should be able to attain the highest attainable health. So we want to provide the best. We don't want to have Kenyan standards. We want to be able to fit into the international standards.
Yeah.
So we are doing our best to keep improving.
And at the same time, we would also want to expand to the county so that it's not only a mental patient from Turkana having to travel to Mathare Hospital here in Nairobi, or Mandera to Nairobi. That would be something that we'll be journeying with you to find out whether the government is investing enough.
Actually, that is already in place. The previous provincial hospitals, most of them had a psychiatrist. But now when we went to the district hospital, there were no psychiatrists, but there were psychiatric nurses. So the system is there, it just needs to be built up. That's why we are saying Mathare Hospital is a referral, meaning that at the health center,
there's a
at
chain
the district,
of command.
at the provincial level, then at least in most of the former provincial hospital, which are now being called referral hospitals, then now they can give adequate psychiatric care, and then if they are not able to sort it out, then they can refer to Mathare Hospital.
I hope it's not going to be too long until we hear the numbers have reduced and that Kenya is a healthier nation, not only physically but also mentally.
I hope so too.
Thank you so much for joining us. That was our discussion here on Table Talk on Africa this morning. I hope you've been inspired and empowered to take on a better approach when it comes to your mental health. That was our discussion today. Enjoy the rest of your viewing. I've been your host, Beryl Ooro.